There is new momentum in the state legislature for New York's Medical Aid in Dying Act. It would allow mentally competent adults who are suffering from a terminal illness get a prescription from a doctor to end their life peacefully and on their own terms. This week, the Medical Society of the state of New York announced it now supports the bill after years of opposing it. At its annual delegates meeting this past weekend, the society changed its policy and in a statement said that the organization, quote, supports physicians' choice to opt in or decline to engage in the processes and procedures as outlined in any proposed medical aid in dying legislation. So already 10 different states and Washington, D.C. allow some form of medically assisted dying. New York joins at least 18 others that are now considering legislation that would do the same. Much of the opposition comes from the Catholic Church, which considers the practice, quote, morally unacceptable.
Life doesn't belong to me. It's God's prerogative when life begins, when life ends. And I can't take upon myself the responsibility or the prerogative of ending life. I have to accept it as a gift, and with all of its ups and downs. Not, every moment of life is blissful. Life is full of sufferings and negativity, but all of it is seen under the rubric of God's providence.
But public opinion has shifted dramatically on this issue. A Siena College poll from a few months back found 58% of New York voters support medical aid in dying legislation. Just 30% were opposed. Joining me live tonight are Corinne Carey, the Senior Campaign Director for New York and New Jersey with the group called Compassion and Choices, which backs this bill. She is live in Albany with us tonight. And then here in studio is Melissa Milch. She is a local advocate. Her late father, Dr. Robert Milch, passed away nearly three years ago, right? And was a tireless supporter of medical aid in dying. I appreciate both of you coming on. And Melissa, I want to start with you and wonder if you can just share with us how you got involved in this, your family's ties to this, and your father's advocacy.
Absolutely, it would be a pleasure. I am the daughter of Dr. Robert and Linda Milch, and my dad was a pioneer in end-of-life care. He started Hospice Buffalo here. He came over to hospice from surgery. And growing up, my sisters and my brother and I always sat, we had family meals and we listened to Dad talk about his day and the big things that he faced in hospice. So that was before. And then on April 27th, 2021, after, I went from being the daughter of a palliative care professional, a palliative care groundbreaker, to the daughter of a man who had just heard he was diagnosed with stage 4 cancer, and as my dad predicted, had 30 days left to live.
So, bringing us to what happened this week, the significant announcement from a large group of doctors in the state, the Medical Society of the state of New York, changing its position and now backing this. I wonder your reaction to that and how you think your father would have reacted as a physician himself and someone who, was at odds with this organization for a long time.
Oh, he would have said it's about time. He would have said, I'm glad you're starting to listen to patients and families.
Let me turn to you, Corinne, and ask you, I know that you're there in Albany, and again, this is something I know that you cover really closely here. Tell me how significant it is legislatively that this organization is now backing this bill and how much of a difference you think that could make.
I think it's a big deal. This could really change the course of this campaign. When we speak with lawmakers, they always want to know where some of the big statewide organizations are on this issue. And now we've got the New York State Bar Association, the New York State Academy of Family Physicians, the National Organization of Women New York chapter, the League of Women Voters New York State, and now we can add to this list of nearly 50 significant statewide organizations, the Medical Society of the state of New York, the voice of doctors.
Melissa, back to you for a moment here. If you can tell me how you have a conversation about this issue with people who feel strongly on the other side. I played a little bit of an interview there with a Catholic bishop who is very opposed to this bill. As you're having conversations with people, or even as you're maybe just trying to educate them or convince them on why medical aid in dying is needed in the state, how do you approach that? What's your message?
Well, I think it's really important to remember that medical aid in dying is something that's extremely personal and it has to do with a patient and their family and their own philosophy on life and living and death, and if religion comes into that, then that too. I would not presume to talk to anyone of a different religion or different faith base and dictate to them how they should live their final days if they are suffering from a terminal illness and incredible pain of spirit and of body. Nor would I, and in return, I would expect not to have that faith-based opinion planted at my feet as well.
Corinne, again, there in Albany, as you look at this, it's my understanding that there were some significant changes made to this legislation earlier this year. Was that a factor in more groups signing on, including the Medical Society of the State of New York? And what do you think are some of the misconceptions that people have about what the bill, should it become law, would specifically allow and how it would work?
Yeah, I think the amendments that were made strengthen an already set of very strong safeguards in the bill. They shore up this idea that healthcare, that health insurance companies can't deny you care that they would otherwise cover, regardless of your decision about medical aid in dying. And the amendments protect physicians who opt out of providing care under the Medical Aid in Dying Act. I think that these amendments help, lawmakers feel confident that this is the right decision to make. I don't know whether the Medical Society would have signed on without them or not, but they were the latest group to sign on. Every other group signed on prior to these amendments. I can't exactly recall your second question, but I will say that, listening to the bishop speak in your opening segment, I'm Catholic. My family is Catholic. Many of the legislative leaders that have championed these bills across the country are Catholic. And so you might ask, well, how is that possible? And it's because this bill will allow everyone to die in a way that is consistent with their own faith and their own values and their own beliefs. Once this bill passes, which inevitably it will, it's just a matter of how much more suffering our legislative leaders will tolerate, nothing changes for the bishop and for Catholics that believe what he's saying. But for the rest of the state, and for those Catholics that truly believe that, you don't need to suffer until the bitter end. There is an amount of suffering that is enough before you are sent back to the hands of a loving God. This bill does exactly that. It protects people's freedom of religion, and it allows everyone to make their own end-of-life choices.
And Corinne, you said there that you believe this will eventually pass. It's a matter of when, not if. What do you think are the chances that it happens this session? It seems to me, based on some legislative sources with whom I've spoken, that this has gotten close in the past. Are you closer now than you've ever been?
We have the votes to pass this bill on the floor in both the Assembly and the Senate. It really is up to legislative leadership whether they will bring this bill to the floor for a vote. There's a lot of time between now and mid-January or mid-June in terms of the legislative time frame. But I think what lawmakers need to realize is that if they wait another 6 months, dramatic things can happen in the lives of you, your family, your constituents in the course of 6 months. And they shouldn't wait another 6 months for another person that they love or that they represent to die suffering.
Melissa, let me end then with the question to you. If any of these lawmakers are watching right now, they're probably not, because they don't have a budget done yet. So I think they're hard at work at that. But what is your message to them?
Please just get out of the way. Remove yourself from the end of life of your constituents. Let them be at peace. Let them choose how they are going to move on in peace. Get out of the way.
Corinne Carey in Albany and Melissa Milch joining me here in studio. Thanks to both of you for coming on and talking to us about this. When we discussed it earlier, it's a difficult topic to talk about. It's something you don't ever want to think about. You've thought about it a lot, and Corinne, I know that you have as well. So thanks to both of you.